Hi, I'm Dr. Rhonda Johnson. Today is Monday, January 6, 2025, and today I'm discussing HMPV. Say what? That stands for human metapneumovirus, a very common respiratory virus that most people have never heard of. It causes symptoms of the common cold: sneezing, cough, runny nose, nasal congestion, maybe slight fever, sore throat, wheezing for people who are susceptible. Now, most cases are mild, but infants, adults over 65, and people with weakened immune systems are at risk for more serious illness. In fact, people with asthma, COPD, or other chronic lung conditions may have a higher risk of complications such as bronchitis or pneumonia. We also see this a lot in babies who were born prematurely and had lung disease of prematurity. Now, HMPV infects most people by the time they're 5 years old. Now, this virus was discovered in 2001, and it's closely related to the RSV virus, which stands for respiratory syncytial virus. As I've said, most cases are mild, but hospitalizations are on the rise due to more severe infections, especially during the winter months. Now, there's a lot of buzz on the internet about a massive HMPV outbreak in China. I've seen those pictures of overcrowded hospitals and clinics and people getting nasal swabs for testing. This is a virus that is seasonal. It peaks during the winter months. Now, neither the Chinese government or the World Health Organization have declared a state of emergency in China. So folks, just relax. And there are other respiratory infections occurring in China as the rest of the world: RSV, influenza A, COVID, and mycoplasma pneumonia. Now, studies have shown that HMPV can cause outbreaks in long-term care facilities, and this virus may account for up to 10% of hospitalizations for respiratory illnesses in the pediatric population. Folks, HMPV is highly contagious. Like all respiratory viruses, it spreads through sneezing, coughing, those respiratory droplets, secretions, touching contaminated surfaces, objects, and then touching your fingers, your nose, your mouth, and your eyes, just like other respiratory viruses. In the United States, it's seasonal with winter and spring prevalence. Now, infections usually last for 3 to 7 days with mild illness. So this is respiratory season. How do you prevent HMPV and any other respiratory virus? Well, cover your coughs and sneezes. Avoid sharing drinking and eating utensils. Wash your hands often. Disinfect your surfaces. Please stay home if you're sick. And you can always wear a mask when you're outdoors and in public settings. There's no treatment. There are no vaccines for this. Treatment is supportive: rest, hydration, medication to ease discomfort. Remember, you may not have heard of HMPV, but it's been around a long time, undiagnosed and underdetected. Now we have new technology that can detect this virus, and we've learned more about it. That's my message. Nothing to fear. Again, use the tools that you already have in place. Take care, folks.